So one of the key challenges of the Philippine healthcare landscape, I would say, is how to bring access of healthcare to the full population or to the base of the socioeconomic pyramid. And I think by far this is the number one healthcare challenge.
For most of the world's pressing issues today, there will not be a workable solution, long-term sustainable solution, unless business comes into play. Businesses make up the largest engine in the world. And if business and civil society work together, then government becomes the enabler.
The Making More Health Partnership is a global partnership that we have between Boehringer Ingelheim and Ashoka. And in the Philippines, it's been crucial for us because the Boehringer Ingelheim team has agreed to help us launch the Ashoka Philippines program. And it's also key because we're able to really focus on identifying leading social innovators in the field of public health.
Lina's story is actually incredible. I have not had any chance in the past to be able to see people making a difference from a different perspective. Her cause in providing palliative care to children with chronic illness is something that is not mainstream. It is not readily available.
The first thing I learned about Lina is purpose, the power of purpose. And some people are really doing some things in their life without listening to the true purpose. So certainly the power of purpose is something Lina taught me. And the second point is that a vision can really become a reality just by persistence and by really putting all the efforts to make it happen.
We had arts and crafts, and then from then we segued into the actual storytelling. So it was an interactive storytelling because we wanted the children and the employees to be engaged. And after that we had a question and answer because we would like to bring out the lessons learned from the story, and this is their takeaway from the whole activity. And this is good for the children because as you know, the children are here in the hospital most of the time and they don't go to school. They don't have the time or the energy to go to school. So it's activities like these which help them with their cognitive development, their social development. And we thank Boehringer for doing this for our children because you are helping us fulfill the Child Life Program's goals of learning, of providing opportunities for our children to learn, play, and grow while they are here in the hospital.
It's better to give than to receive kasi you get more eh. When you give, you get more. Sabi ko nga when people ask me, why do you love joining volunteer activities? You don't get anything out of it. And I always tell them, actually it's unfair for the people na tinutulungan mo. You get something more in return. You get to go home with a full heart. You get to go home with a lot of things that you learn from these kids, from these people that you get to interact with.
Here we are working in a corporate world, exposing ourselves to a different side of the system. So I have to thank Lina for that awakening. I have to thank Ms. Girly Lorenzo from Kai Foundation for providing us that opportunity to be able to make a difference, to be able to help other kids. And hopefully with this partnership, we will be able to do more.